Today, as I want to present a case, I have named the case as Millennial Era Case. Why I have named it that way, I will let you know in a while. So, as ma'am has already introduced me, I would like to skip my slide. Just wanted to tell that I am an MD scholar at Department of Practice of Medicine at Bhasin, and I have done my graduation from Bharati Vidya. So the lady that is presented to me is a 35 years old Hindu Punjabi female, educated till bachelor's, presented with a complaint of low grade fever with palpitations since past 2 days. She has a sensation as if heat from the eyes, आंखों में से जैसे heat निकल रही है, headache in the vertex. There is a sensation of someone is pinching at times. This sensation of pinching she feels all over the body, which I felt a little peculiar. सिर्फ head में उसको नहीं लग रहा कि चूड़ी चुभ रही है, but सारी body में लग रहा है. And fever is since 2 days and palpitations. This is what I have told this till now. Okay. And now no one has asked her any questions. She herself further mentions that I am tired. She imagine a patient who is coming with a complaint, मुझे बुखार है, मुझे palpitations है. There are many infectious diseases that we could think of and we would be उसके लिए questions पूछने की सोचेंगे. But she herself mentions, मैं पूरी तरह से थक गई हूँ, मैं drained हो गई हूँ. I have no idea. Hello? राइट. सो शी सेज मैं पूरी तरह से थक गई हूँ, मैं ड्रेन्ड हो गई हूँ, मुझे इस सिचुएशन से बाहर निकालो, मुझे नहीं पता इससे बाहर कैसे निकलना है, आप मेरी मदद करो. Now there is no correlation between the mental state and the fever, which is since 2 days. So let's see how the case unfolds. So she says further, मैंने कहा आप एक्सप्लेन करो कहाँ से आपको बाहर निकालना है. So she says, I am not willing to do certain things, but they are forcing me to do. But I cannot tolerate this anymore. I am responsible for everything, but now I am sick and tired of it. I am suffering the burden of responsibility. Why I am held responsible? And then she makes a hand gesture and says, मेरे को नहीं करना तो नहीं करना, मेरे को force मत करो. This was the exact hand gesture that she made by saying it. So,
Aditi,
yes.
as you are mentioning, pointing out towards a hand gesture, I would like to
Right.
tell you that your video is not visible.
Uh, Ma'am, I have opened my video from another phone because this laptop does not have that good camera.
Okay, fine. You continue then.
Yes. Wait a minute. I will open from this one also. Okay, so now both the cameras are on. So the hand gesture, exactly, it is important. So I am elaborating it again. So she says, मेरे को नहीं करना तो नहीं करना, मेरे को force मत करो. So this was how she wanted to emphasize on it. So now I don't want to contribute to such horror relations, is what she says further. Right. They will. Now I asked her, how are your relationship with your husband? So she says, initially I used to give flowers. She goes to the terrace and she used to get flowers for the husband and used to express her love. हर चाय के साथ वो अलग अलग फूल रोज टेरेस से जाके लेके आती थी. And she used to do various efforts to make the birthday special. And she also used to put various efforts to put the Valentine special. But now she expresses her hurt by saying that now since few days, as he has not reciprocated, so I have left doing all of that. But up to alas, like an alas, she mentions that now what happens if I am not doing, now we have left everything and we're not able to do anything, we celebrate nothing. She also mentions that she has suicidal thoughts. Now I inquire her related to suicidal thoughts, and she mentions that she has no thought of how she's going to do the suicide. So there is no any act that is in her mind, but such thoughts come and go. But she says that I do not have any intent of doing so. Even I talked her a little, तो वो बता रही हैं कि मैं अपने घर पर अपनी मेंटल स्टेट बताती भी हूँ. तो एवरीवन इन द हाउस इज सेज दैट इट इज बिकॉज ऑफ माय ओवर थिंकिंग, इट इज बिकॉज ऑफ माय डाइट, आई एम not in a proper diet and so I am a little fat and I think so much and this is the only thing that is responsible and there is nothing else, and they make fun of me that my brain does not work properly because of my overthinking. Doctor, what should I do? What can I do? I cannot stop this overthinking. My husband says तू इतना सोचती है इसलिए ऐसा हो रहा है, but I cannot just stop. You help me out of this. So Then she says कि जो relations I tell my husband about them, but he does not take a stand for me. He just says that it is your responsibility, it is your duty. तुम अपने रिश्ते निभाती रहो, पर अब मैं ये और नहीं कर सकती. She is angry very easily and contradictions make her irritable. ये उनके husband की side से I took the case. सब मेरे को ही माइंड को रिलैक्स करने कहते हैं, पर मैं कर ही नहीं पा रही, मैं कोशिश भी करके नहीं कर पा रही. So when I go out of my house, now she goes to grocery she goes out, visits different doctors, different clinics. She has started because she feels suffocated at living at the same place. Now I thought that this is a mere mother-in-law and daughter-in-law situation, but she says even when she goes to her own house, her maika, she says there also I do not want to talk to anyone. There is no fight, but still I do not feel like talking. So in the family history, father is diabetic and hypertensive, mother is suffering from gout, grandparents have died. There is no mention of any pathology. Siblings, brother is hypertensive. Now the menstrual history, till last year, I was taking treatment for PCOS. For 8 years, she took treatment for PCOS, which she developed. She got married. After 1 year, she delivered the child, and after delivering the child, she says that since that time only the periods started getting irregular, and since 8 years I am trying to get the periods on track, but it is not happening. And she also wants to conceive another child, but that is also not happening. So it is a very recent case that has come to me. So I have also mentioned that the LMP is 10th of Jan. So she says after 3-4 months of missing the periods, now the periods has come last in the month of January, and she has also came to me in the month of January. So 10th Jan को मेरे periods last आए थे, and I had to take some allopathic medicines to stop the bleeding. पहले periods were not there, and when they came, they were so profuse that she kept on bleeding till 14 days, and it could not stop the bleeding. And now what you can observe is a common symptom, as sir, the previous presentation by the sir he has also told the hirsutism, and you can see ovaries which are enlarged, and there are multiple cysts in the ovaries. So physical journals could not collect much of the physical journals. Desire is sweet. She has no cravings as such. Dreams, she says that I am, मेरे dreams में वो आता है जो मैं reality में बोल नहीं पाती. I am speaking something which in reality I cannot. And she explains another dream where she says that I and my daughter is driving a car. Now I would like to put a notice over here that her daughter is also taking, she's also coming to me, but she is a 6 to 7 years old girl. She says that the daughter is driving the car and I'm sitting beside the daughter, and people are stopping us, but she is driving the car and I'm encouraging her to drive the car. Everyone is stopping us, but the car will not stop. This is what she is dreaming presently. So as the timeline of the case, PCOS 8 years back, then she developed hypothyroidism 6 years back, hemorrhoids 2 years back, and mild depressive disorder, which I feel that she is suffering, is from 6 to 7 months. Okay, again, I had mentioned in my introduction, I have done a postgraduate diploma in mental health. So I put a Hamilton's depression rating scale. There were 70 questions that were asked. I would like to put to notice that she scored 17. So up to 17, we consider mild depression. From 18 to 24, it is moderate depression, and 24 above, it is severe depression. So till 17, it is mild depression. So the case I have initially मैंने case को बताया था कि I have said it is a millennial case because you can see hypothyroidism also, PCOS also, and mild depressive episode also, and hemorrhoids. So this is not something very uncommon, but it is a complex disease which comes commonly to us. So case analysis. Mechanism of the case is predominantly psychotic. You can see that there is accumulation of various follicles, and the follicle is not rupturing. Also, she's suffering from hypothyroidism, and there is no any autoimmunity or genetic mutation. So, and there is suicidal thoughts, but then there is no any act, or she's not planning to do it. So, predominantly, I felt the case is psychotic. Understanding of the pathology, we would not be able to go to every pathology that she's suffering from, but just the main ones. That PCOS is everything started. So it was the first complaint that she felt. So immature follicles refers that she does not want to mature, and again androgen, which are the precursor of testosterone, again reflects that there is a masculinity in her appearance, and she has lost that touch of femininity. So I have put the case in the 8-box method given by Dr. Shankaran. The pathology, most of the things are already told. The pathology is hypothyroidism, hemorrhoids, depression. She has come to us with fever, headache, and palpitations, and not with the other complaints. There is pinching pain. I have generalized it. Irregular menses and craving. Sweets, generals, I have already told. Dreams, running away from people. People are stopping her. She does not want to stop the car. And sensation and kingdom, I still feel that my case still here is more on an factual and emotional level and has not came to the level of delusions. So I have not used the kingdom method to come to the conclusion of the case. So I've left the box. Myasm is psychotic, and observations, hirsutism, there are broad masculine shoulders, and there is obesity. So prescription, these were the things. All the rubrics that I have taken are more something that I was very concrete and firm upon. So I've only taken those which I was firm upon. The important ones were contradictions, ailments from aggravates, anger, ailments from aggravates, suppress. So there, I thought there was suppressed pent up anger. Manish, which I can observe. Pain, pinching was something very peculiar because she feels it in the entire body, and I could not correlate it with any pathology. And the food and drinks may sweet desire, and there were no cravings, and she is obey. So there were many books that I referred, but only a few I would like to mention. Soul of Remedy by Dr. Shankaran. He says that she will be let down, betrayed, disappointed by people that trust her. She seeks is not only dependent. वो calcaria और magnesium कैसे होते हैं? Dependent होते हैं. But friendship and romance. Romance was something that she kept on emphasizing, despite she was 35 years old. She could have not emphasized that much on romance, but that was, I think, the need of the case. At the end also, she said that my husband is what is the main that pinches her a lot. So this makes her do. She was caring, she was nurturing, she was going out of the way. Who gives the rose every day, get the flower upar se every day, you know? But she kept on doing it. But when hurt comes, she withdraws completely. There is great sadness. So all this made me go towards natramur. There were many other remedies, many other books that I referred. This is what I have highlighted. What I have highlighted here is ना, जो मैं lines highlight करी हैं, are what I thought that the case के अंदर ये essence है, जो इस book के अंदर लिखा हुआ है. And then I referred Essence of Materia Medica by George Whitfield and Comparative Materia Medica by Dr. Farrington sir. And differentiation between pulsatilla, natramur, and sepia was what I referred. The prescription I gave was natramur 1 ml SL, TDS for 1 month. Next month, in the month of Feb, when she comes, I have, when you read so much and you think, yeah, I have done the right prescription. So you're so energetic that the patient will come and will, encourage you and motivate you, wow, doctor. But nothing of that sort happened in this case. Menses appeared. So now menses has appeared. Usually never subsequent menses come. So the generals were getting better. So I thought that maybe this is the right medicine as general is getting better. Her mind state was completely the same. She was still crying and she was still feeling the same depressed. But only the generals in the menses were better. Fever जिसके लिए वो आई थी वो नहीं आया. Palpitations were not there. So these things were better. So I thought the medicine is working. I gave her again SLTDS 1 month. Now as per Boric, we can say that the medicine remedial action of natramur is 40 to 60 days. So I waited approximately 2 months, but next time when she came, she said, "Doctor, कोई फर्क नहीं पड़ रहा, सिर्फ periods मेरे को आए हैं, मेरे को fever वगैरह नहीं है." पर again that depressed mood, that sentimental thing, and that crying and crying for help, all was there. So again, I thought of repertorizing the case. So this time, I just added 2 more rubrics. I did not change the repertory sheet. Only indifference, apathy, duties to domestic, because she has started remaining out of the house for a prolonged time. She does not want to do all that responsibility thing. And delusions, imaginations laughed at to be. Whenever she was coming to me, she was emphasizing on that they are not understanding me and they are making fun of me. And I also inquired the husband, who was quite sympathetic towards her, but she felt that no, they laugh at me. So now, as per the repertory sheet, I have given a sepia 200 in 1 dose for 1 dose, and I have given SLTDS for 15 days. So this time I have not given the medicine for 1 month. And then when she came now in the month of April, just before submitting this case, जब deadline था case का, तो when I submitted the case, there was no improvement. So I was like, I am CPR दे तो दी है, मैं case submit कर दूं, and then there will no improvement. How will I present? But up to my I don't know. I worked for the case, and she says that she is feeling well, and she says, "Doctor, आप मुझे वही medicine repeat कर दो जो आपने अभी दी थी, उससे पहले वाली तो कुछ खास थी नहीं." So I just gave her SLTDS. We will wait for the action of CPR. 40 to 60 days is what Dr. Borik has suggested. So we will wait for 1 month and 15 days and see if CPR helps her to regularize the menses. So the due date of menses is 13/4, like in few days. So if that also indicates that yes, the menses are on time, I would be really happy to see that my patient is doing well. So till now हमने यही progress देखी है इस case की. And now I would like to say success comes from doing common things of life uncommonly well. This is a case where the pathology was not that something very rare that I am presenting, but I have presented it with my whole heart, something, a complex of such diseases which comes commonly to us. And I hope she gets well by it. I want to thank all the masters जिन्होंने मुझे कुछ भी सिखाया है. I say कोई भी एक approach नहीं follow करो. मतलब this is what I have implied. I am learning all the approaches, and as per my case, I would select the approach. I would also like to mention at Prana, Dr. Shardul Joshi sir and Shrikant sir, who have also helped me to learn homeopathy. And thank you very much for giving me so much time and attention. Thank you.